Welcome students to another episode of Learning with Lafferty. Within this chapter video, we're going to be talking about the respiratory system, the heavy breathing, breathing in, breathing out. So hopefully you take a big deep breath in and breathe out. And like always, I've got to introduce Manee. Manee, you need oxygen just like we do. You don't just get it from the water, you get it from the atmosphere. Okay. One random fact about manatees is they cannot stay underwater for a long amount of time. So hence why they have to float to the surface. And I'm glad they do, because that's when they are visiting us and saying hello to us. So within this chapter, we're going to be talking about the respiratory system working in correlation with the cardiovascular system. So our heart, our blood vessels that we've talked about in previous chapters, and even the lymphatic system are all going to work together to make sure that all this air in the atmosphere is going to get to the oxygen part of it, as far as the gases, to every body cell that needs to stay alive. So we definitely want to make sure we remember some of the key parts in this chapter from prior chapters. So again, always when you're learning, it is a progressive, it's a building block. So if there are previous chapters that you're still struggling with, understanding some concepts, make sure you go back into your textbooks and definitely go back and watch parts of my videos to help you understand things such as gradients. Okay, so things on one side and things on another side of a membrane. Okay, so think about, there's lots of oxygen out here. It's got to get through multiple membranes, tissue membranes, in order to get to the cell. Okay, once it gets to the cell, it still has to cross past another membrane, that plasma membrane, to get inside that cell so the oxygen can get to the mitochondria and make lots of energy. Okay, so our cells can stay alive. Now, another word besides gradient that you need to be aware of would be the word of diffusion. Okay, so diffusion is the most simplest, basic, passive. So that would be underneath the Chapter 3 in most textbooks, and your all's for sure. Definitely looking at that video relating back to the cell and mechanically transporting things across that plasma membrane, but across membranes throughout the whole body. So diffusion, view it again kind of like a T-bag. And then the next concept kind of relates back to, of course, the blood is carrying on the red blood cells these little molecules of oxygen. And remember what oxygen is. Okay, that's very important. It's a molecule. It's an element, aka one of the four major elements, ions in our body. It should be the highest. We need to kind of look at that periodic table of what is within our body. And then you need to make sure, yes, it's flowing through the tubes attached to a red blood cell, but then we also have to view that there's other liquids, other body fluids that need to be balanced. Okay, so breathing actually is one of the ways, through the use of pressure, that is going to also push that lymph back to our subclavian vein that we would have talked about in the previous week. Now, one concept you definitely going to see within this video through my demonstrations is the key word of respiration. So respiration is, and Manee will help me, breathing in and breathing out. Okay, that's just what they call respiration. The process where we get oxygen, okay, from the environment is delivered inside of our body that has to get to the cells. Now again, also with that, we think of oxygen, we got to think of the byproduct, the waste, which is carbon dioxide. Okay, it's transported obviously to the outside in reverse. Okay, so we're going to talk about, of course, breathing in and breathing out, but definitely the importance of it. If there is internal exchanging, is the process of where it gets to the tissues, the cells, because remember what tissues are, a group of cells, and the oxygen then just diffuses from the blood to that cell, and of course carbon dioxide travels back from the cell into the blood to be used when the blood needs it. Now, external gas exchange. So if internal gas exchange is inside the body, kind of makes sense of the name. External gas exchange is our lungs. Okay, take the oxygen that diffused from those air sacs into the blood, and carbon dioxide diffuses out of the blood to be eliminated. So you think of internal exchanging and external exchanging. Now, besides respiration, we're going to hear a key word of ventilation. And the word ventilation is going to directly relate to us breathing. Okay, that is important. So when you see that word ventilation, definitely think about what it is. It is us breathing. And we know we can only live for a few minutes without oxygen. So far as functions of the whole system of the respiratory system, is of course exchanging the air, okay, inside, outside, exchanging those gases, okay, that's important, but also us breathing also is going to warm up and is going to add humidity to the air. Okay, so remember, think about your skin during the winter months, especially how it gets dry and cracked, and then pathogens can get in. The same thing can happen with all these moist mucosous membranes, okay, kind of way back to tissue chapters of that line all the openings, and we definitely want them to stay, again, they're going to have that mucus on them, but if they start to dry out and crack, and that's where humidity, if it's too low, then it's going to start drying out those areas, and then we set ourselves up, unfortunately, for pathogens to get deep inside of our body. Now, the phases are important, okay, so definitely know what respiration is, okay, again, obtaining oxygen from our environment, bringing it to a cell, giving it its food, and then taking the waste away. And then pulmonary ventilation is referring to actually the process of breathing. Okay, so again, I know respiration is kind of one of those words that's misused. It really is the whole process, okay, but ventilation itself is directly related to just breathing in and breathing out. Now, it's important to understand the parts. Now, you're going to see next in my demonstration to look at the parts of the respiratory system. And even the manatee is going to assist, okay, within the video of showing, like, when we breathe out, what is happening, and then when we're breathing in, what's happening. But I want to talk about the structures a little bit so that way you have a little bit of knowledge before obviously watching the demonstration. So, we have an upper and a lower part of our respiratory tract. Our upper respiratory tract, so definitely it's important to kind of separate it a little bit when you think about disorders and diseases. The upper part of our respiratory system is going to be the nose. Okay, these are the organs. Pharynx, so pharynx is a fancy word for throat. Larynx, okay, which I'm struggling with, unfortunately, a lot, with laryngitis, so that's going to be our voice box. And then part of our trachea. Okay, now some textbooks will have it, just saying the trachea is part of the lower respiratory, and that's okay, okay? But definitely knows if you have an infection in your nose, your throat, and your voice box, okay, the voice region, that is going to be an upper respiratory infection. So trachea, the second half, or the whole trachea. Below is, of course, lower respiratory. So trachea is your windpipe, that's one. The bronchial system, okay, that's a whole tree. Okay, so we have bronchi, bronchus, okay, bronchioles, okay, and then we eventually, those little tubes that come off the trachea end at a little thing called alveolus or alveoli. And these are just going to be little air sacs that end at those bronchial trees. And then one more thing you don't want to forget about also within that region is, of course, the lungs that are like sponges that are going to hold all of those little tubes that have those little air sacs at the end of them. So definitely view the respiratory system that of a tree, and of course you'll kind of see within my video, I'll relate that for you to be able to see during that part. And also when you're thinking about that, knowing the airflow going through the nose and the mouth, it could go through either one, but it needs to get, so air, far as the atmosphere, those air molecules have to go all the way through these areas, upper and lower, and get to those air sacs, because it's at the air sacs of where the capillaries are. And if you remember back to what the capillaries are where the exchanging occurs. Now there can be a little bit, obviously, along that pathway, all of those cells, those tissues, need to get oxygen too. So there will be some exchanging for that particular part. But for it to complete that circle that we started many, many videos ago, with the heart, the blood vessels, and even the lymphatic system, all that connection is carrying all of these molecules around our body. And it is very important that every single cell get the oxygen and even give carbon dioxide back so the body can use it as it is needed. Let's talk about the nose. Okay, the nose is also referred to as your nasal cavities. Manee has nose too, just like we do as humans. And this is, of course, where air is going to get in to the respiratory system. They're also, of course, called the nares. Okay, nostrils is another name sometimes we'll see related to the nose itself. Now, immediately inside of our nose, that's where you're going to see of course, if you think about the roof of the mouth, when you look in and you were to look way far back, obviously, using a tool to do so, that top of the cranium, of course, when you get up in there, that's where we're going to have that nasal cavities. Okay, if you've ever suffered from sinus infections, you know very quickly that airspace. The purpose of, of course, the nasal cavities or any of those sinal cavities, when you think back to the bones, is to, of course, lessen the weight of the bone. Okay, I know what you think will make it compromise making it strong, but actually helps with that. But we know that also helps with our voice. So we think about when our nasal cavities are inflamed, and then of course we get extra fluid, extra mucus within that area, then of course we have a different sound, okay? But it helps to also resonate our voice, okay, as a part of that nasal cavity. Now, I'm not going to get into this video because I've talked about it in previous videos when we think about smell, but obviously deep inside, attached to cranial nerve number 1 is going to be, then we have one nose, is of course those cranial nerves that relate to the sense of smell, which are the olfactory nerve. Okay, so the olfactory receptors are deep within that tissue within your nose. This chapter focuses more obviously in the structure and kind of what the nose does for the respiratory system. Now we have mucous linings. Okay, now within this region also you're going to find these little shelves that are called conches, okay, or turbinates. They're just shells that kind of protrude on each side of our nasal cavity. They're going to help to warm up the air as we're breathing it in. Okay, so that's definitely some things to think about besides the sinuses and those little shelves. One more thing I definitely want to point out, you have the lacrimal sacs that drain into, these are the sacs that collect the tears into the nasal cavity. Hence, when you smell something like an onion, it's going to cause you to cry. There's a direct connection, and I would have talked about it a little bit when I talked about the nose under the senses, okay, itself. So the nose is, of course, nasal cavities. And then the throat is going to be called the pharynx, okay? So go from the nose to the pharynx, okay? And it's very short, okay, even on a manatee. But us, the throat region, if you were to place a mask, so behind your nose, behind your mouth, and right underneath your chin, okay, this region here, and you can kind of feel it if you push against it, and you hear kind of weirdness with your vocal cords because it ends at your larynx, okay? So the pharynx is your throat. It's only about 5 inches long. Like it's a very short, most of us say, oh, my throat hurts. Well, we're actually touching our trachea when we're in that particular region, okay, for most of us. So when we up here, that's going to be the throat pharynx region. So it is divided into 3 different names, and it is important now within this video I'll talk about it, and actually in my video that I have for digestion I'll talk about it again, okay, because obviously not only do we bring air in through our mouth, but we bring in food into our mouth. So the throat will be in 2 different systems as far as its function of what it can do. So nasopharynx is behind your nose, okay, your nasal cavities. Oro, mouth, okay, oropharynx is going to be behind your mouth as far as your throat region. And the larynxopharynx is the lowest portion that would be right where your vocal cords are at. Now, one key fact when we think about the throat region, hence why we have a lot of problems with our throat, is because the nose, both nasal cavities, your mouth, your esophagus, okay, when we get to it in digestion, your larynx, so voice box, and all those tubes in your ear, those auditory tubes that I talked about in the senses chapter, connect up to your throat. So think about if you have bacteria that likes to crawl, it can crawl up and it can crawl back down. So if you have a middle ear infection, it can affect your throat. If you had a throat infection, then it can affect your ears, your mouth, your nose. Okay, so all those areas are directly connected from your pharynx. Now the next region is going to be your larynx, and larynx is going to directly relate to your vocal cords, okay, or voice box as it's commonly called. So it connects your pharynx to your trachea. Okay, trachea will be next after this. Now it is going to have, you're going to see within that video, it is going to be the part that we're going to find an Adam's apple. Okay, so there's a projection commonly known as the Adam's apple. That is the interior part of thyroid cartilage that protrudes in the front part of your neck. Now it is considerably larger in men than women. Okay, so women actually do have Adam's apple, but and of course hence the name, it's a lot larger and more prominent within a man, but it helps to protect his thyroid cartilage, okay, is what the Adam's apple is within this region of your larynx. Now just like the other regions, we're going to have mucosous membranes that line there. And this is going to be, far as speech, is going to be affected by your vocal folds, or as we also call them, the vocal cords. So kind of like strings on a guitar, okay? And you kind of think about when you have problems such as laryngitis and voice issues, you think about the size, the diameter of a guitar string that you're going to see and hear later in the video is going to directly affect how well that the sound, how high it is in pitch and how low it is in pitch. So almost think about coding, okay, those chords. Now two other names that are also important within this region is the glottis and the epiglottis. Okay, so the glottis itself, okay, so we have the, of course, the nose we talked about the cavities, you know, for the sinal cavities, not teeth cavities. We talked about the mouth and the throat. They all serve as, again, helping us when we talk, making it sound louder, stronger. Now the space between the vocal cords, that is the glottis. Okay, this is partially open during normal breathing, but is widely open when we force breath in or out, okay, when you're breathing. Now, besides the glottis, you have the epiglottis. This is like, the books mostly kind of say like a leaf shape, okay, but it's a little cartilage that covers the voice box region, the larynx, when you swallow. So the name literally means, of course, epi means above the glottis. So both the glottis and the epiglottis help to cover the larynx, okay, the voice box region during swallowing. Okay, that's important. It helps to keep the remainder of food and liquid, hopefully most of it, out of the respiratory tract itself. You could feel the larynx move up towards the epiglottis during the process by placing the pads of your fingers on your larynx as you swallow. So if you press here and you swallow, you can actually feel the movement itself. So hence when mama said to you, chew your food, don't talk while you're eating, okay, because it will get you choked up, and it's true, okay. We don't want the food going down our trachea, which is next. We want food going backward to posterior, which is going to be where our esophagus is going to be located. So we know if we get food down the next pipe into our windpipe, the trachea, we're going to aspirate, okay? That's when you, of course, when you're laughing or talking while you're eating, and of course, if it is too big and gets stuck in this non-collapsible tube of your trachea, then of course the Heimlich maneuver would have to come into play. So the Heimlich maneuver is used to get something that's stuck in your trachea, okay? Your windpipe, it's that tube that extends from the inferior, the bottom of your larynx, to the mediastinum, okay? Mediastinum also could be called, just superior to the heart, okay? So you think about where the heart is, the mediastinum region is here, okay? So just above the heart. And this is the purpose of the trachea, is just to get wind, air out and in. Okay, that is the purpose, okay, that it serves in our body. Do know with the trachea, and of course you'll see that in the demonstration, it is mostly non-collapsible, which is very important, but it's also bad because it has no flexibility barely to it. So that way if you get something stuck on it, it is very difficult where you have to use pressure to pop things out of it. Now the next is the tree. Okay, so I really want you to start viewing the trachea as the tree trunk. It's an upside down tree, and then so we go from the trachea, a big tube, to, again, smaller tubes and smaller tubes and smaller tubes. Kind of sounds a little bit like the cardiovascular system. Okay, the blood vessels are going from an artery to arterial to the capillaries to venules and veins. Okay, it's a little similar to that. So the bronchi is the primary. So you have two main that will branch off, because obviously we have a left and a right lung. Okay, so go from trachea, then you're going to see left and right bronchi, the beginning, the primary, and then they're going to, of course, keep splitting off. So a view, a tree trunk, tree branches, smaller branches, and eventually at the end of the branches is where that you're going to find the alveoli or the alveolus. Now, all along that passageway, remember that just like every other part I've talked about, the mucosous lining, okay, you have the mucosous lining throughout. And do remember, when you think back to the cells, those little cilium that stick off of the cells. So when we get, we ingest something that our body doesn't like, it can help to push it along, push it up or push it down out of the body or into an area that the white blood cells entrap it in that mucus, that the white blood cells can come and destroy it. So we go from trachea to bronchi to bronchioles, which is the smallest of these little conducting tubes that get the air in and out, to the terminal bronchioles. And at the end of those, of this tree, we're going to find some air sacs called alveoli. Okay, or alveolus, singular versus plural. And they're covered completely by capillaries. And that's where you're going to see that exchanging. The air molecules, oxygen molecules, have to get all the way through all of the different parts in order to get to these air sacs, to get to the capillaries, to allow the exchanging to happen from outside and internally at the blood level. And you could almost view these little alveolas like grapes. So you're going to have a big bundle of grapes, and then you pull off a smaller little bundle, and then you could pull off the individual grapes. So all of that bundle, okay, the sac as it's sometimes called, because you have the ducts, then the sacs, and the individual alveoli are going to be all covered within capillaries. Now, one thing that's important with the alveola is its job. It's the function. It's the one that allows the exchanging of the gases between air and blood. That's where the red blood cells are going to get the oxygen they need. Now, respiratory membranes, okay, we've talked a lot about on the outside of all these organs and parts, okay, it is important because there is still that there, but there's a special liquid that only these alveolus make, and it's called surfactant. And surfactant is made by a special cell within the alveola, and the purpose of it is almost like a grape, if you want to view it as a grape, to prevent it from being squished and looking like a raisin. So the purpose of this special liquid is to help prevent the alveoli from collapsing. So it's all about that surface tension, that water tension, the pressure, the gravity as we're breathing in, that pressure is constantly pushing against the walls to make them either overinflate or underinflate. Definitely be thinking of a balloon. When you blow it up, it gets bigger, and when it shrinks down, that pressure on both sides, either in and out, is needing to be filled in. And then last but not least of the organs of this system are going to be the lungs. Okay, we don't want to forget about them. Okay, they're where the air, of course, is going to come in. They're these thinly walled sacs inside of them called the alveolus. Okay, that's very important. And definitely do not view the lungs just as like a balloon that takes air in and gets bigger and then pushes air out. Definitely view the lungs more like sponges. We have two lungs, of course, one in each side. Okay, now between them, of course, are the heart, the great blood vessels we've talked about before, and of course the other organs of the mediastinum or sternum region. Okay, that's the space and organs that are between the lungs. Okay, that particular region itself. Now, as far as names of the lungs, the apex on this one's at the top, and the base is at the bottom. Okay, of course, you'll definitely need to understand that because it's opposite than the heart. Okay, so if you were listening to someone's apex of their lungs, you're listening at the top of the lungs. If you're listening to the base of the lungs, you would be at the base. Okay, but remember the heart, we talked about that, it was totally opposite of that. Now, one important feature when we think about the lungs is going to be the linings on the outside. But remember, the lungs live inside the thoracic cavity. So we talked about the thoracic cavity under the ventral cavity. Would have been in my very first video. Okay, it's important to understand that there's linings inside of that cavity that hold in the thoracic region our lungs. The lungs precisely on the outside, we also have linings called pleura. Now you have two different membranes, okay, and you would have learned about this in the tissue chapter of the visceral and the parietal. Now the parietal is the one that is going to cover the course inside that cavity, and the viscera pleura is the one that covers the organ. Okay, remember viscera means organ. So the pleura relates to the linings, the membranes in the lung region. Now between the parietal, okay, and the viscera, those two layers, we have a little bit of a space. Okay, it's a very thin film of liquid that lubricates these membranes. Right, and that's very important. So we think about, of course, when we're breathing in and breathing out, the movement that happens in the thorax cavity, but also the movement that's happening at the lungs directly themselves. Okay, so a little bit of space that we need there. Of course, some conditions you'll see, and I'll talk about later on, would be, of course, if we get too much liquid in there, too much fluid, if we get air within that space, also if we get blood, and the disorders that can come from that. In this part of the video, Manee is going to assist us in the parts of the upper and lower respiratory system. So air can enter two different areas, the nose and the mouth. Now the nose is your nasal cavity, and inside your nasal cavity, the job of it, the function, is to, of course, bring air into the lungs to get to the capillaries to do exchanging. But the nose also has those terminates, which I talked about earlier, which are shelves that help to add humidity, warmth to the air that we breathe in. Now remember, all of these areas I'll be talking about are openings to the outside world, so they would have mucosous membranes that line them. Now, as air goes through the nose, then the next area it can go into is an area called the pharynx. So the nose and the mouth itself are directly connected to the pharynx. Now, the pharynx is called your throat. So again, nose and mouth directly connect to your throat. And your throat, if you were wearing a mask, that's where your throat, your pharynx would be located. So there's a top portion that is closest to your nose called the nasopharynx. The next portion that's in the middle that's close to your mouth is called the oropharynx. And right above your superior to your larynx, which will be your voice box next, is a laryngeal pharynx region. So definitely know the three regions of your throat, the pharynx. Now below the pharynx we're going to find next the larynx. Now the larynx is going to be where we find our voice box, and it's also where we're going to find the Adam's apple. Now the Adam's apple is going to be a protrusion. Now this particular portion has thyroid cartilage that protrudes out the interior portion of the neck. This projection is commonly called, of course, the Adam's apple, and it's considerably larger in a man than a woman. So the larynx has the Adam's apple. Now, besides the Adam's apple, of course, you'll find the voice box, which are just folds of mucosous membranes that help to allow us to talk. And they're located centrally in the superior portion of your larynx. These vocal cords, aka the vocal folds, vibrate when air flows over them. Now the vibration and the length and tension of the vocal cords and the distance between them regulates the pitch of the sound. The amount of air forced over them then regulates that volume. The difference in the size of your larynx and the folds is what accounts for the difference between, of course, a man and a woman's voice. A man's larynx is larger than a woman's, and as the vocal cords are thicker and longer, so they vibrate more slowly, which gives a lower range of pitch. Now, of course, obviously do not also forget that there's definitely muscles, and in this area you're going to find nerve endings. Now, the space between the vocal cords is an area called the glottis. This is partially open, almost like a mouth, during normal breathing, but widely open when we're forced breathing. Now, the muscles in this area help to keep those folds together to close off the glottis and help to keep the materials out of the respiratory tract when we swallow. They are also closed to help in holding one's breath against pressure in the thorax cavity, as when straining when we're lifting something heavy. Now, right above the glottis is going to be an area called the epiglottis. Again, we're still in the larynx region. The epiglottis and the glottis help to keep foods and liquids out of the remainder of the respiratory tract. So as we're eating and talking, then food could continue down and go into the next area, which is going to be our windpipe, and then we could aspirate things inside of our lungs. The next area is the trachea. Now, the trachea is called our windpipe, and it's almost non-collapsible. It's made up of these C-shaped cartilage rings that help to protect the windpipe so air can get from your larynx down the tube to your bronchial tree. Now, being almost non-collapsible, it is very important to understand that if we were to swallow something and it was to get into that tube and get stuck in that tube, we would have to perform the Heimlich maneuver, hopefully to pop it out of that tube. Now, one thing to know about the trachea, that right behind the trachea is going to be our esophagus that I'll eventually talk about under digestion. And in the trachea, as we eat things that are too big, since it is an open tube that does not have much flexibility to it, sometimes we'll feel that food going down. The esophagus will expand into the trachea as we eat food. So that's why when we eat something that's too large and it actually then goes posterior into the esophagus, we might feel it going down because it's rubbing against the interior portion of the trachea. Now, the next portion you see from the trachea, and I've set it on the table so you can definitely see it, is inside of our lungs, is going to be the bronchial tree system. Now, at the inferior portion of our trachea, that is going to branch into our lungs, which I'll talk about here in a minute. But I want to look inside of our lungs of this bronchial tree system. Definitely view this whole area you see here like an upside down tree. So the trachea is going to be the trunk, and then you have a bronchial tree system, which is going to be a whole bunch of tubes that are going to have a terminal end that is going to end at this thing called the alveoli. So trachea is going to send air then to the bronchus. The bronchus then is going to branch, of course, left and right, and you'll see that when I show the lungs. And then it's going to go to smaller bronchi, the bronchioles. And then the tubes get even smaller and have a terminal bronchi, or bronchioles, that end at these little tiny air sacs that you see. And those air sacs are going to be called the alveolus or alveoli system. And next, let's look at what they look like. Now, at the end of the terminal bronchioles, we're going to find the smallest subdivision of that bronchial tree, and that's where we're going to find clusters of tiny air sacs called the alveolus, or the alveoli. So definitely view them as a whole bunch of grapes, and then individual little clusters of grapes, and then an individual little alveolus. So at the end of all of those bronchial tubes, we're going to find the clusters that branch even more to smaller clusters that will eventually branch to an individual little alveoli. Now, these sacs are covered by capillaries. So I put kind of the red there to show you, to help you with the capillaries. Now, each one of these alveoli are covered and are physically touching the capillaries that are coming from the arterioles. There are over 300 million of these alveoli in the human lungs. That's where the exchanging of the gases will occur. So all through that tube system that we just talked about, at the end of it is where you find the exchanging that is going to occur at the capillary beds. Now, one thing unique is the name that you see here of surfactant. And surfactant is going to be a lipid protein that is being secreted within the alveoli that's going to help to fill in the space and the surface tension when the pressure from breathing in and breathing out is occurring. So definitely visualize that air coming in the tubes all the way down that bronchial tree to these individual little alveolas of how much pressure, like that of a balloon. And think about when you're blowing up a balloon and deflating the balloon. If there's too much pressure, it could cause the alveola to explode. And then as it is being pulled out, it could cause the alveola to shrink and then to turn and look into like a raisin. So think about the difference between this. What's good to visualize the alveoli like grapes. Think about if the surfactant is not being produced and is not being produced in high enough quantity, then our alveolas will then be shriveled down and they are no longer then physically touching the capillary beds. So think about that distance there, then the exchanging of gases cannot occur. So it's very important to know that surfactant is only made inside the alveolus, and it helps to prevent the surface tension by causing and preventing the alveoli from collapsing when we breathe in and we breathe out. But also remember, when you think about conditions that destroy, once an alveola is gone, it is gone. So it is a cell that once it's destroyed and we no longer have, or if it's shrunk down through the different diseases that could occur within the body to look like this and can no longer touch the capillary bed, then we do not have exchanging of the carbon dioxide and the oxygen that the body needs to keep or needs to get rid of. Now remember, as air flows down through our trachea, then the next portion that's going to hold your bronchial tree is going to be encased inside of the thoracic cavity. So kind of back to the very first video that I would have talked about, the lungs and the heart are encased by membranes inside of the thoracic cavity. And we'll talk about a couple other membranes that also line that cavity and line the organs. Now, air as it flows down through the bronchial tree that is inside of the thoracic cavity, those little tubes are inside. Now you'll see here that I have a sponge for the lungs, because it's important to view. Yes, I will be using the demonstration here after a little bit of a balloon and how that air will flow in and blow up the balloon and air will flow out and deflate the balloon. But very important to understand that our lungs are more like sponges, that these little tiny branches, the bronchi, are inside of. So definitely important to understand when we think about diseases and how that the lungs are made, that if these sponges are not flexible enough, it's not going to and help to prevent air from flowing to the alveolus at the end of the bronchial tree. So very important, don't just think of your lungs as being balloons that inflate or deflate. Definitely view them more like sponges, because that is what they are. Now also within this area, it's important to understand the thoracic cavity that we're going to have linings, membranes called the pleura. Now the pleura are going to have two different membrane linings that help to coat your thoracic cavity. One of them is going to coat the inside of the cavity, and the other one's going to protect the lungs themselves. The pleura is two parts. One that coats the thoracic cavity inside, and a portion of it that coats, called the viscera, that covers the lungs directly. So a viscera, any type of membrane that's named viscera, is covering the organ on the outside directly. That's part of the serous membrane that I would have talked about under the tissue chapter. Now that you watched a demonstration about the parts, let's talk about what respiration is all about and the 3 steps. Okay, so we talked about earlier, it's this, kind of umbrella term, but respiration is 3 different things. Ventilation, sometimes called pulmonary ventilation, exchanging, and transporting. So let's talk about the first step, which is ventilation. Okay, ventilation truly is breathing. Breathing in, breathing out. Now, it is directly controlled by the brain. Okay, that is important. Okay, we think about, we've talked a lot in prior videos about the nervous system and the parts of the brain, but we definitely need to go back to the medulla oblongata, the respiratory center that lives within your brainstem. It literally sets the rhythm of how well you're going to breathe, okay, of how quickly you're going to breathe. Or that happens at your brainstem. So definitely know it's the medulla oblongata. It's that central nervous system that is going to help controlling the ventilation, okay, breathing in and breathing out. And that's going to send information through the pharynx nerve to affect 2 main muscles, okay, to help with breathing. We'll do breathing in first, and of course we have breathing out. So impulses are going to be sent through the pharynx nerve, okay, and again, kind of go back to that central nervous system, the peripheral nervous system. So central would be a part, again, of the brainstem, would be a part of the central nervous system, and then the peripheral nervous system is the branch that controls the nerves directly. So pharynx and intercostal nerves, because remember, bringing air in, that information is sent from your brainstem directly to your diaphragm to contract. Okay, that's the chief muscle that contracts. When it contracts, that is going to cause air. Then we're breathing in, which is very active, and that increases the volume of the air that came in, increases the volume of the thorax, and by doing that, then the pressure then is going to decrease. So definitely we'll talk about this here in a few minutes of a diagram to help you understand the difference between pressure going up and pressure going down. It's also referred to as Boyd's law. What goes in must come out is important, okay, throughout the body, okay. Of course, definitely when we think about the heart, kind of the same thing. How much blood came in needs to leave, okay, with it. So what comes in must come out of our lungs if we want homeostasis. So there are 4 steps in breathing in. So stimulation of the nerves. Number 2 would be contracting. So the muscles need to contract. That then is going to do number 3 by increasing the volume within our lung, our thoracic cavity. And then number 4, by doing that, cause the pressure, because we go from a high to low gradient. Okay, that is important, going from a high to low gradient. Okay, you kind of think of them this way to this way. If we got lots of oxygen molecules here that we need to get in, that's high. Bringing it in then is to that low, and you definitely will be seeing that next within the video. Now, once we breathed in, now we're going to talk about breathing out, which is very passive. So exhaling, expiration, has still 4 things. Okay, so pulmonary ventilation as far as breathing out. We're quieting. The medulla oblongata is not sending messages anymore. So if you've quieted those pharynx and intercostal nerves, now then the diaphragm and the external intercostal muscles are quiet. That's going to cause then the air to leave. It's going to decrease our thoracic volume. And by doing that, then the pressure goes up. So remember, high numbers here to the low number, which is important. Okay, so definitely needing to know, which we'll see next, of what happens when we breathe out. The process of breathing in and breathing out is going to be called respiration. Now, respiration itself, not only is it breathing in and breathing out, but that also includes the transporting of the oxygen and carbon dioxide gases around our body, and then exchanging them at the capillary beds. Inhaling and exhaling in the process of respiration, breathing, is called pulmonary ventilation. And pulmonary ventilation in a respiratory cycle is one breath in and one breath out. Now we're going to talk and look at next of the gradient changes between a high number and a low number. So pulmonary ventilation is inhaling, inspiration, and exhaling, expiration. Now the key players in pulmonary ventilation are going to be the lungs. Now in the lungs, we take air in and we take air out. And definitely think about the compliance that the lung tissue needs to have, similar to a balloon. That the more we blow up a balloon, the more stretchy, more elastic that it's going to become. But also think about if we were to poke a hole in the balloon, a collapsed lung, the problems we would have with all those alveolas that are inside of my lungs that need to exchange the gases that have come in. Now, one other key player is the thing below my lungs, which the lungs literally touch, is your diaphragm. So when we breathe in, the diaphragm that presses against the abdominal organ is going to move downwards, and that's going to allow room for the lungs to expand. Now when we breathe out, the diaphragm then is going to raise, and then as you see how it touches, it's going to cause air then to be forced out of our lungs. So definitely know what's happening to our diaphragm is important. So diaphragm needs to contract during breathing in, inhaling, and it needs to relax when we exhale. So contracting, going down, relaxing brings it back to where it was at. So contracting, inhaling, diaphragm then in relaxing moves back up. And that is going to assist in the process of inspiration and expiration, pulmonary ventilation. Of understanding the muscles that we're talking about, our diaphragm is the main chief. It has to be activated first. Then the assisting ones would be the external intercostals or the internal intercostal muscles. But there's also one other group of muscles that will assist when you're forcing, especially when you breathe out. Hence, when you're doing exercises and stuff, they tell you to breathe out because that's going to contract your abdominal muscles, okay? And when those abdominal muscles are contracted, it helps to force more air out because that is important. You're always going to have a certain amount of air that in that part of transporting, okay, inhaling and exhaling, that will occur. You always have a little bit of air that's going to be left over, either breathing in or breathing out, unless you force a little bit more out, a little bit more in or a little bit more out. But there's always still going to be a little bit of residual that is going to be left over. So ventilation is breathing, okay, so inhaling, exhaling, okay. Now that's a cycle. So one cycle of that would be just one breath in, one breath out. So if that's step one in respiratory, step two is going to be exchanging. So exchanging happens two different places, at the lungs, more precisely at the alveoli, and at the tissue, at the cells. That is important. So gas exchanging, remember, diffusion. So gas needs to move down its pressure gradient, okay, from high to low, high volume, high pressure, low pressure, okay? That's what's important. You would have seen me talking about, okay, the atmosphere stays the same, okay, and that's always high, and we go to low, and then this became high all of a sudden, and then it needs to go back to low. So that gradient is diffusion. So external exchanging happens between the alveoli and those capillaries that they're touching. The internal is once it's inside of the blood system, and then the blood then is going to bring it to the tissues. Now they always kind of list it as a partial pressure when we talk about the numbers of gases. So the pressure of each of the gases within a mixture is going to have that P in front of it. So when we're at the heart, okay, more precisely, we'll start with the right atrium, when we're right there, that's where you're going to see the lowest of our oxygen, and the consistency we're going to see of the carbon dioxide. Okay, that's the lowest. But when we go then from right ventricle to that pulmonary system of circulation to these alveoli, that's where the number then is going to drop up significantly high. It's going to more than double, almost triple the amount of oxygen molecules we have. But you still always have carbon dioxide. And then, of course, as it travels through the body, now it's left the left ventricle and it's gone through the aorta and traveling around the body to wherever it gets. Then that's when you're going to see the number go down in oxygen. Carbon dioxide is going to go up a little bit more at that point at the tissue level before it gets back to the heart at the right atrium, and then that process is going to go all over again. So unfortunately, in prior videos, and I would have mentioned this, you'll see where they say that the blood is deoxygenated totally when it's blue, and it's fully just oxygenated when it's red. Well, that's not the case. Okay. There's always going to be oxygen and there's always going to be carbon dioxide. Now, one thing to understand about what is occurring and what happens to get air, oxygen to exchange, and then the byproduct of carbon dioxide to exchange and attach to the hemoglobin, is related to pressure and volume. Now, the atmosphere stays the same as far as the pressure. But remember, volume and pressure, when one goes up, the other one must go down. So this is going back to transporting, going back to homeostasis, a high gradient to a low gradient, or if it's easier to remember, a low number is being changed from a high number. So if high to low, that's going to be diffusion. So when our lungs are not taking in any oxygen, we're at rest. Both the atmosphere and the lungs are the exact same number. They're at homeostasis, 760. But if we have a whole bunch of molecules of oxygen over here and just a few, remember, we need to go from a high gradient to a low gradient. So when we breathe in, the number goes then from the atmosphere of 760 to 758. And you notice that this number is lower than this number. So from a high number to a low number. That's important. That's how diffusion works. So then that oxygen that's here is going to move inside. And as we are breathing in, our balloon then inflates, and then we go from that high number to that low number, and now we've got a greater volume inside of our thoracic cavity. So you'll notice though, as the volume went up, that number had to go down. Now, once we've done that, the second process is breathing out. So now we have a high amount here and a low amount here. So we're going to go from a high number to a low number, and we're going to decrease the volume of our thoracic cavity. And as we decrease the volume, our pressure then has to go up. So then our number went up and is greater than the atmosphere. So if volume went down, the pressure goes up. And then all of that oxygen then is going to exchange out. And then that's the process of exhaling. Definitely know the difference. That if the volume is increased, the pressure has to decrease. Notice the number is lesser than this number. And then when the volume went down, the pressure number has to go up. That's going to force things from the high to low gradients. So definitely helps to write some type of number, even if, some books do not have numbers. Always know the atmosphere is always going to stay the same. So let's say you just even said 100. Make sure that this number goes down or up in correspondence to what is happening to the volume of the item. So the thoracic cavity volume goes up, that number has to go down. And then if that volume then goes down, the pressure has to go up, and that will force the molecules to go the right gradient move. The movement will force the gradient then to change. So remember, we're going from a high number concentration gradient to a low number through the process of diffusion. Now, how is the oxygen carried is that transporting part, okay? That last part of how truly respiration works. Now, prior videos, the blood chapter, we know the only sole job of the red blood cells themselves, for its function, the main part is going to be carrying oxygen and carbon dioxide around the body, okay? But it mostly carries oxygen. So 99% of the blood, red blood cells, are carrying oxygen on their hemoglobin. So oxygen is carrying mostly by the hemoglobin, where carbon dioxide, some of it is carried by the hemoglobin, but most of it is going to be converted into an ion called bicarbonate. And that's very important to understand what bicarbonate is. So the next part of this video, the next demonstration, I want to show you what bicarbonate does for the body. Now I want to talk about how does the respiration work in relation to transporting. 3 ions are very important, of the 4. Remember, we have 4 main elements, ions, that make up the majority of our body. We have oxygen, carbon, and hydrogen. The 4th one would be nitrogen, but we're going to talk about these 3 with respiration. Now, oxygen we obviously want in the highest number, and it's going to be in this order. Nitrogen would fall below hydrogen, is we want the most oxygen within our body. So as that exchanging is happening at the capillary beds, our hemoglobin inside of our red blood cells, and most of it is being carried around our body by the red blood cells. So oxygen is carrying 98% of all the oxygen attached to the hemoglobin to get to the individual cells. Now the byproduct of oxygen then is going to produce carbon dioxide. Now carbon dioxide then is going to be transported through the blood, through our blood plasma, through our body, and it's going to be converted into the ion element of hydrogen. And that's what's very important, that our oxygen levels are high, because if we have too much carbon dioxide in our body, that is also going to increase the amount of hydrogen. And if you remember anything about the pH scale, once the hydrogen level goes up, then that is going to cause the body to become more acidic. So breathing is going to be one of the buffer systems that's going to control the pH within our body. So most of the oxygen is carried by the red blood cells. Carbon, some of it is carried within the blood plasma, but the body is actually going to convert that carbon dioxide into hydrogen, and that bond between these 3 things turns into an ion called bicarbonate. So bicarbonate would be HCO, and that is important to know. Bicarbonate as an ion is going to be an ion that's going to help to decrease the body's natural TUMS. So it's actually the hydrogen, carbon, and oxygen together in that ion called bicarbonate is going to help to bring down the acidity as a body when those 3 things come together and work together. But we know if we keep these ions separate, then that's when we could run into problems. So definitely know, oxygen, carried by red blood cells mostly. Carbon dioxide is carried mostly when it's converted into HCO, which is going to be bicarbonate. But remember, if we have too much carbon, that's going to be lesser oxygen we'll have, and that can also increase the hydrogen, the pH level, and make our blood more acidic. Now there is another type of CO, carbon oxygen bind together, called carbon monoxide. So you think about carbon monoxide, it's literally the carbon is going to push off the oxygen away from the red blood cell. And you think about if a red blood cell no longer has the oxygen it's needed and just has the carbon, then you're not going to have oxygen flowing around your body. And that's why it's so dangerous when we think about carbon monoxide poisoning. It's because the carbon is pushing off the oxygen off of the hemoglobin. So the body can no longer carry the oxygen in the red blood cells around our body. So carbon monoxide and carbon dioxide. And the difference between them, again, is when we truly have carbon monoxide poisoning, it's directly affecting the attachment of our oxygen. Now that we've talked about respiratory, the three processes of ventilation, exchanging, and transporting, let's talk a little bit about what happens when the body is at dysfunction. Okay. Now, very important to understand along that passageway of the central nervous system, there is also going to be receptors that are located throughout the body, but especially in a couple areas. So in the carotid arteries and near the aortic, we're going to have these special chemical receptors. And if you remember anything about receptors, those are cells that receive information to send an effect. Okay, so these peripheral chemical receptors, and of course going up to our brain and then coming back to our heart, are going to detect the oxygen and carbon dioxide levels. Through that is, of course, going to be that feedback loop. Okay, so if it detects that the oxygen levels are low, it could do a couple things. It could speed up, it can make more red blood cells, or it could slow things down also too. Okay, so it's constantly monitoring how much blood is getting to your brain and around your body and the levels of oxygen and carbon dioxide within that. Now, some of the disorders are going to be, of course, the parts we've talked about. So think about the organs. So the first one, of course, in the nasal cavity, we can have, of course, itises. We could have a deviated septum, okay, which one side of the septum is that separating wall. We could have things such as nosebleeds, okay, so definitely be thinking about the disorders that could directly affect the nasal cavity, okay, and the structures themselves. Now, of course, we can get infections, itises that can occur throughout the upper and lower respiratory system. So if you're thinking about an upper respiratory, again, it's affecting the nose, the pharynx, the larynx, maybe a part of the trachea. And then if it's lower, it's definitely the trachea. We think of conditions such as, of course, colds that can affect both of those. We think about different, of course, RSV, viruses that directly affect those regions. We think about croup. Okay, croup itself, of course, is the condition. Of course, we think about associated with, the different infections that are affecting mostly that lower, but are coming from upper respiratory problems. Of course, flus and pneumonia. Okay, so what is pneumonia? It's very infectious. It's inflammation. It's an itis of the lungs. Okay, and it's where those air spaces become filled with fluid. Okay, then you can't have that exchanging of the oxygen. That's why it can be, and it could come from, of course, not only viruses, but it could come from bacterial infections, and that's where you end up with a lot of excess fluid filling up those bronchioles, the bronchial tree, and then, of course, that prevents that air molecule from even getting to the capillaries to allow the exchanging. Of course, bronchitis would be directly affecting an itis of the bronchial tubes. Now, other conditions will be such as tuberculosis, which is also very infectious, okay, and it's usually caused, of course, mostly by bacterial infection, okay, and this, of course, we know bacterium, bacillus, can invade any body tissue, but it likes to grow in a warm, moist area, and of course, the lungs is perfect for that. Now, other conditions could be asthma, okay, of course, that's related, we think of allergens, okay, but the cause of asthma can vary, but it can come, of course, respiratory infections, toxins, smoke and air, but allergens play a huge role in this. And asthma itself, the triggers for an asthma attack could also be a lot of rapid air movement into an already inflamed system. Now, COPD is a name you definitely want to know, and COPD stands for chronic obstructive pulmonary disease. That's very important. You need to know what that stands for. emphysema are all classified under that umbrella term of COPD. And we know that emphysema is characterized by dilation and then destruction of our alveolus. And one thing about those alveolus, we have millions of these little tiny grapes, okay, at the end of our bronchi, and once they're gone, they're gone. So you think about if I start out with 100 and then all of a sudden I've got conditions that is totally destroying them and I get down to 20, that's when I'm not going to be able to breathe and we'll need a ventilator. But even then it gets to a point of, yes, I can pull air in, but if there's nothing attached to, as far as capillaries, to get air in and out of the blood system, then the body cells are going to die from lack of oxygen. Now, the other diseases are going to be important, and when you think about also the alveolus, are sudden infant death syndrome and even acute respiratory distress syndrome, and that goes back to the surfactant. So if a baby is born prematurely at a certain point during development in the fetal stage, that's when the surfactant is starting to be made by the alveolus, and it needs to get to a certain threshold in order for the body to maintain homeostasis. So that's why usually if babies are born too quickly, premature, they'll have to, of course, use more of like a synthetic type of surfactant. Now, cancers could also be a disorder that, of course, it affects this system too. And the last disorders to think about would be the ones that relate directly to the pleura. Okay, so the pleura itself, remember, is the coating on the cavity that holds your lungs and directly on the outside of your lungs. But remember, there's a space between those, okay? So when you think about the space between those regions, remember, you need to have some fluid. Too much fluid is a problem, okay, because then it prevents the lungs from fully expanding. And also, if we get certain viruses, bacteria within that fluid, then that could cause infection to set in. Now, pleurisy is the name of the inflammation of the pleura, okay, and again, it usually comes with, like, if you have some type of lung infection, it's particularly like tuberculosis or pneumonia. Now, pneumothorax is when we get air within that space, okay, so then we talk about, the collapsing of the lungs is usually where you'll see that occurring. Hemothorax is blood in that space, okay, and that comes from, of course, you think of a chest wound. And this area, you'll have to remember that it's very tightly close. Things are touching, so it is important that we do have that non-friction so it doesn't build up with heat. But since things are very tightly spaced, any expansion is going to cause problems to the surrounding organs. So hopefully within this chapter you have taken in lots of breaths in and lots of breaths out slowly to relax yourself, to not hyperventilate or hypoventilate. Just like manatees have to come to the surface, it is still important that you are coming to the surface, meaning you're taking breaks in your knowledge learning. Okay, so hopefully as you are watching my videos and studying in your textbooks, you're taking multiple breaks to de-stress, maybe do some meditation also within that is very helpful to calm that brain down, to calm the body down, to be able to focus more, because we have to have oxygen and homeostasis throughout our whole body for that to occur. Well, I look forward to seeing you within the next video,